Health workers in Gaza have begun vaccinating more than 600,000 children against polio. Aid workers are carrying out immunizations across the territory. The program depends on Israel and Hamas sticking to agreed humanitarian pauses in the fighting. Polio spreads rapidly in unsanitary conditions and can cause paralysis and death. And we can now speak to Dr. Richard Peeperkorn. He represents the World Health Organization in the Palestinian Territories and joins us now from Gaza. Dr. Peeperkorn, the drive to vaccinate 650,000 children started yesterday. How's it going?
Yeah, I think it's a daunting task. And greeting from Gaza. I'm actually at the WHO office in Al-Balah, and this is also the Emergency Operations Center for polio. So actually, it's a meeting ongoing with all the key partners, Ministry of Health, UNICEF, WHO, UNRWA, but many of the NGOs. We do this really jointly. Focus is to vaccinate at least 640,000 children and get a 90% coverage. And the campaign is two phases. The campaign started right now, and in 4 weeks we will repeat. We need to cover at least 90% to actually stop the outbreak and the transmission in Gaza, but also prevent international spread. So you touched on this area-specific humanitarian pauses, which are absolutely critical, and we welcome that. So we have now divided Gaza in 3 zones. So you talk about the central zone where we are now. Then we are talking about which target population of 156,000 children. Then the south, target population 340,000, and then the north, 150. In each zone, we have 3 days to vaccinate, and when needed, we'll add another day. So we started yesterday, and first day was good, I would say. There was an enormous, good vibe on the streets. We talk about 513 teams, and we reached actually more than almost 87,000 children with these 513 teams. And I went to many of those fixed sites and mobile teams. Many parents with their children, etc., and actually happy to come and
so
do
people,
this.
excuse me for interrupting, but the people of Gaza are willing to bring their children to get vaccinated.
Definitely. I mean, there's always actually a high vaccination acceptance in Gaza and the West Bank, by the way, as well. And before this crisis, the routine immunization program in Gaza had coverage as high as 90 to 95%. Actually, higher than a number of European countries, high-income countries. So there's a huge acceptance. And even today I went with a number of teams, mobile teams, and we went to this along this coastal road where you see these endless makeshift shelters and camps. And everywhere we went with this mobile team, checking on children, etc. Almost all those kids were vaccinated in this phase. But again, it's just the second day of the campaign. We still have 10 days to go. And it's absolutely critical that all the parties stick to this so-called humanitarian specific pauses, and the families can go out, that their children can go out, and that these 513 teams, 2,200 health workers and community outreach workers can do their job.
Very briefly, please, what's the biggest hurdle standing in the way of reaching your goal?
I think the biggest hurdle would be, well, first of all, I think the complexity of the situation. And as I said, all these pieces of this puzzle, they have to fit together. The humanitarian pauses is the most critical one. I want to also add something. Overall, when you look, so we are now a little bit in a polio bubble the first 2 days. We make some good step forward, but the overall health situation is deeply concerning. And you talk about hospital functionality, less than half of the hospitals are partially functional, and less than a third of the primary healthcare centers are functional. We see, of course, an environment of water sanitation conditions, which is horrific, and it's a breeding ground for many infectious diseases, including, of course, polio. We've seen an enormous amount of hepatitis A, jaundice, diarrheal diseases, so the oral fecal transmission, etc., also links to polio. But maybe a small ray of hope. If we can do this kind of campaign, maybe much more is possible in Gaza. Of course, ultimately, what everybody wants here is a ceasefire and a start of peace arrangements and a peace process.
Dr. Richard Peeperkorn from the WHO's West Bank and Gaza office. Thank you very much.
Thank you.